Hello, Internet. Welcome to the Economy Q&A brought to you by Press Association and Full Fact. Full Fact is the UK's independent fact-checking charity. We've been busy fact-checking the election. You can see all of that work at fullfact.org. Today, we're answering your questions on the economy. When I say we, I mean the Institute for Fiscal Studies, who are joining me today. Be sure to send us your questions, so click comment below, send it in. We're taking questions on the economy, so anything that you want answered. And then remember to click share, so your friends and family get a chance to ask their question too before the election. I'm Mivan from Full Fact, and I'm joined by Helen Miller and Paul Johnson from the Institute for Fiscal Studies. Hello. Hello.
Hi.
Can you tell us a little bit about yourself and the Institute for can you tell us a little bit about yourselves and the Institute for Fiscal Studies? What are fiscal studies?
Well, fiscal studies, in the way that we take it, means essentially studying everything the government does with your money, spending it, taxing it, and what it means for how well off people are, how much they're earning, how that's changing, what's happening to the income distribution, what we're doing with pensions and welfare, all of those sorts of things. So how well off people are and what the government does and how it impacts on you. And we do that entirely by looking at data. So we're always data driven. We're not sort of theory driven. We're not driven by just thinking. It's all based on evidence and data and analysing it.
Great, sounds good. It sounds like you grapple with a lot of the big questions.
We do our best.
So a question that we got in earlier is, what is a budget deficit, and are debt and deficit the same thing?
Well, the budget deficit is just the difference between the amount of money the government gets in from taxes mostly and how much it spends. And at the moment, it spends quite a lot more than it gets in taxes. So we've got a deficit of about £60 billion each year, which is quite a lot less than it was immediately after the crisis. But it's more than it's been on average. Debt is different. Debt is the accumulated amount of deficits that we built up over time. So we've got a deficit of about 60 billion, but we've got a debt of about 1.175 trillion pounds. So a very, very big number.
So what's that compared to other countries? Because a number like 1.3 trillion sounds big, but how big is it?
Well, our deficit, the amount we're borrowing every year, is bigger than nearly all countries. It's advanced countries. Right. It's pretty big still, even though it's come down a lot. Yeah. Our debt is quite big, but there are quite a lot of other particularly big countries which have slightly bigger debts than that. But to put it in perspective, our debt now is bigger than it's been at any time since the mid-1960s.
Okay, so another question we've got in is, what is GDP? How do you measure it? Do we want it to be high?
So GDP is just the way we try to measure the size of the economy. So you can imagine that what economists are trying to do is measure all the production that happens, so all the activity that people and companies are doing, measure that and say, how much would we do this year? So bigger is better, because we'd like a bigger economy, so that we have more income, we're wealthier. It's just a measure of the size of the economy.
So how does that link to inflation?
So inflation is a measure of how prices are changing over time. So I think you go to the supermarket, you buy bread and milk, but over time those prices change. So what inflation is doing is saying, by how much are those prices changing? So at the moment, inflation for most household goods is running at about 1.8%. So that means that on average, prices are now 1.8% higher than they were last year. And that basically matters because it affects how far the pound in your pocket goes, so how much you can buy with your income.
Okay, just going to take a quick moment to just say, be sure to ask us your questions. We're taking them live, and we'll try and answer as many as we can in the half-hour slot that we have. So debt deficit, GDP, inflation. Can you give us a little bit of a history lesson? You already have done, but what has happened to our economy in the past 10 years?
Well, if you look at the economy as a whole, it hasn't done very well in the last 10 years. We had a terrible crisis in 2008 and 2009, and the size of the economy shrank really quite a lot. I mean, historically more than it's ever shrunk in a recession, actually, certainly since the last war. By about 8% over those couple of years. And the real problem has been that it hasn't grown very much since then. So usually when you go into recession, you have a terrible couple of years and then the economy kind of starts pulling away again. But this time round, actually, if you look at national income per person, so you take GDP that Helen was describing and divide it by the number of people, it's barely any bigger now than it was in 2008. So that's 9 years without a growth in this national income per person, and that's dreadful. We really haven't experienced anything like that in a century, and probably longer, and that's what underlies a lot of the issues that we're seeing. So earnings haven't grown as a result of that, and indeed earnings are actually, if anything, below where they were in 2008. Living standards have barely grown as a result of that. So all of this really stems from that big financial crisis back in 2008 and 2009 and the very slow recovery we've had since then.
So we've got a question in from Emma which says, so has the deficit actually been reduced like this government claim?
The deficit's come down a lot. I mean, the deficit really expanded dramatically following the recession, and it's come down by about 2/3. And it's come down partly because there's been a little bit of growth, but significantly because the government has really pulled spending back over those years. So, as I say, the deficit is still bigger than it's been on average since the last war, but it's only about 1/3 the size it was back in 2010.
So we've had another question in which says, why has the national debt risen to 1.8 trillion, like you said, in spite of austerity? And what has all this extra borrowed money been spent on?
Well, it's down to this issue about the direction of the deficit and the debt. So the deficit has come down, but we're still borrowing a lot every year. So we're borrowing less than we were, but we're still borrowing quite a lot. And so the debt is piling up, and it's piling up, and it's getting towards the way we normally like to think about it as knocking on for 90% of national income, and that's getting to quite high levels. What's the money been spent on? Well, it's been spent on all of the things that you would normally expect money spent on. The biggest chunks of it are pensions and health. They're easily the two biggest chunks of what we spend money on, and actually they're two things that we spend more on now than we did back in 2008. A lot of other things, certainly relative to the size of the economy, we're spending less on. So we're spending less on things like police and justice and some aspects of education. But what we're doing over time is more and more of what we're spending on health and pensions and actually long-term care as the population gets older.
So we are definitely spending more money on health and, what was the other thing, sorry? Pensions. But does that mean that we're getting more for our money for those things? Does that mean we're actually improving healthcare? And does that mean that pensions are better now? Which might be too big a question to answer, but I just wondered what you thought.
Well, state pensions are higher now than they were back in 2010. It's one of the very few areas that the coalition government and the Conservative government have completely protected, and they've raised those pensions faster than inflation, actually faster than earnings over that period. The thing about health is that while spending on it has grown, it's grown much more slowly than ever it has done in the past, because our demand for healthcare increases over time, partly because we're getting older over time, as a population, I mean, obviously individually we are, and partly because the cost of providing healthcare tends to go up. So whilst we're spending more on health, we're spending probably less than we need in order to keep up with the demand.
So when do you predict that our borrowing will be reduced?
Well, our borrowing already is reduced, as we were saying, quite a lot relative to 2010.
Yeah.
Now,
but when will it go away entirely?
Well, that depends on a lot of things. And one thing it obviously depends on is who wins the election. So the Conservatives have got a very different set of policies to the Labour Party. They actually want to bring borrowing down to zero through the 2020s, and that's why under the Conservatives we'd have quite a lot more spending cuts. Whereas Labour have said, actually, we're quite happy to borrow quite a lot, actually. And so they wouldn't aim to get it down to zero. In fact, they wouldn't aim to get it down much below where it is at the moment. And whoever wins, the other thing that's going to really matter is how well the economy goes, what happens post-Brexit and all those sorts of things. But there's big choices there between Labour and Conservatives. Labour saying, look, borrowing, we're quite happy to borrow really quite a lot. Conservatives, in the end, we actually don't want to be borrowing anything.
So what would be the knock-on consequences of those two parts?
Well, the knock-on consequences from the Conservatives' point of view, of course, is that you can't get borrowing down to zero without cutting spending or increasing taxes. And they're clearly saying that it's on the spending side they want to continue squeezing, though actually taxes will rise under the Conservatives as well. For Labour, there's obviously an awful lot more spending and an awful lot more taxing that they're intending to do. The question, though, is because they're also doing a lot more borrowing, is there a long-term problem associated with the scale of that borrowing if that means that the debt doesn't, in the end, start coming down?
So on taxes, both of them include taxes, but which taxes raise the most money?
So we get the majority of our taxes, our tax revenues from three big taxes, which are income tax, national insurance contributions, which you can just think of as another type of income tax, and VAT. So those taxes bring in about 2/3 of our revenue. We then get another decent sized chunk from corporation tax, some from taxes on properties and taxes on fuel, and then a whole host of other small taxes. But most of it comes from taxes on income or consumption.
Okay, what about the land value tax? I've
So
heard a lot about it.
yeah, there's
Do
been
we have to
lots of
sell our
discussion
gardens?
about land value tax and about garden taxes.
Yes.
So the idea of a land value tax, so we currently have two taxes on property. So one is council tax, which people will be familiar with. It's basically the tax you pay to live in your home. The other is business rates, which you can think of as the equivalent for business properties. A land value tax would be an idea to replace those taxes with a different type of tax that says rather than value the whole property, so the land and the building on it, you would just value the land underlying it. The idea behind that is to say we don't want to stop people from building on the land. If you build a very nice business building, your tax rate goes up, and we don't think that's a very good feature. So the idea of a land value tax would be to just use a tax base based on the value. The discussion recently is about this garden tax. Has been the idea that maybe we'll move council tax to a land value tax and we'll be taxing gardens. I think that's misleading because council tax is currently based on the whole value of your property, including your garden. But the council tax system is actually ridiculously out of date, and we probably should do something about it. So it's currently based on the values of properties in 1991. Just think about how much has changed since 1991. That's got to be silly. And it's kind of bizarre in the sense that it's levied as a high portion of value for low value properties than for high value properties. So we probably should look at the council tax system, and we'd have a choice about whether we want to sort of update that system, bring property values up in line with what they currently are, maybe make it proportional to value, so to make it fairer. Or we could do a different route and do a land value tax, and that would be a bit of a different type of solution. But it's basically getting at it's an idea for how you tax property effectively.
The other thing that's worth saying is that the bit of land that currently doesn't get taxed at all is the big bits of land. So if you've got 10,000 acres of farmland or something, there's no tax on that, no business rates, no council tax, nothing. And actually, a land value tax presumably would start to get at that.
So how much money would it potentially raise? Do we know?
Any amount that you wanted, depending on what rate you set it at. Now, obviously, there's a limit on that, and actually, we have add council tax and business rates together, and relative to a lot of countries, it's already relatively high here. You could certainly get some more, and you could particularly get some more from expensive houses and from this land, agricultural land and estates that are not currently taxed.
So you also mentioned corporation tax. Could you explain a little bit what that is and how ours compares to other countries?
Sure. So corporation tax is the tax that businesses pay on their profits, and they pay it on profits that are generated in the UK. So that's not just about UK sales, it's about how much activity, how much value was produced in the UK, how much profit did that create, and that gets taxed. So there'll be some companies that actually sell a lot of stuff here, but actually that the underlying price, think of a phone in your pocket. So you're buying the phone here, but a lot of that will have been produced in other countries, both the actual physical hardware of it and the software, the things that make it cool and make the nice interface. A lot of that was done abroad. So we're not taxing all of the profits from the sales of that phone, we're just taxing the activities that were done in the UK. So currently we have a rate of 19%. That's kind of low by international standards, so most other large countries have higher rates. But that's actually one of the areas where the parties are offering very different things. So under the Conservatives, they'd like to see that rate cut further to 17%. The Labour Party would like to reverse a lot of the cuts that we've seen in recent years and move the main rate back up to 26%. So at 26% would still be lower than most of our kind of big international competitors like the US, France, Germany, but we would be less competitive than other countries in Europe. And higher rates make the UK a less attractive place to do investment.
We've had a question in from Michael that says, if corporations have their taxes raised, will they look elsewhere? If so, what countries in Europe have a lower rate of corporation tax?
So I think it's worth saying there is that corporation tax clearly isn't the only factor that affects where firms want to decide to locate. They're also going to look at the infrastructure you have in a country and how good your skilled workforce is and how close you are to the market and lots of other factors. So corporation, it's not like everyone goes and crams into the lowest corporation tax country. But tax is a factor that matters because if you put your activity there and you get a lower tax rate, that's more attractive for you to do investment. So if we had higher taxes, I think, yes, it would make us a less attractive location. It's a bit hard to look just at headline rates. So like Ireland, for example, has a lower headline rate. They have 12.5%, so they're pretty attractive. But there's also important features of the tax base. It's not just about the headline rate. And some other European countries also offer particularly attractive tax bases that make them good destinations for investment. So higher tax rates would make us less attractive for investment.
Okay, so say we did increase corporation tax. Who would feel that tax? Would it be the companies themselves? Would it be the employees? Would it be the consumers? Would prices go up? How does that play out?
Yeah, so the important point to realise there is that ultimately all taxes, every single one of them, have to be paid by people. The interesting question is always, which you're getting at, I think, is which people?
Yeah.
So in the first instance, I think that you'd think that higher corporation tax means lower corporate profits. That's instantly going to affect shareholders because they're the ones that have the claim on those profits. Mm-hmm. And that's not just rich people who own shares directly, although it's them too. It's also people who hold private pensions. So indirectly, all of us, I suspect, are shareholders through our pension funds. So shareholders feel it. The thing that economists worry most about, actually, though, is how those taxes can be passed on to consumers or to workers. So we just discussed how corporation tax can lower investment. Mm-hmm. But if that happens, lower investment in the UK means that we have less productive workers and fewer jobs. So less productive workers, fewer jobs, lower wages. And that's a way in which corporation tax can end up being paid by workers. You also mentioned prices. Companies can also respond to higher corporation tax by increasing their prices. Now, which of those groups actually end up paying is going to vary over time and across countries, mm-hmm. depending on lots of different factors. But one of those three groups has to be paying. It's probably more shareholders in the short run, and it's probably more workers in the sort of medium to long run.
Okay, just going to quickly talk to you guys again. If you have a question for us, be sure to send it in. Just click comment below. We're going through all of them and trying to answer as many as we can in the 30 minutes that we have. Although it's not 30 minutes anymore. Back to the questions. Renationalisation. Is it financially possible for Labour to renationalise the railways?
Short answer is yes. Okay. Most of the value of railways is already nationalised because the track through Network Rail is now nationalised, and that's actually got a very large amount of debt associated with it. So in a sense, we've already done the difficult bit. Okay. When it comes to the running of the railways, they're all run by what are called franchises. So train companies bid for that, and some of them actually pay the government money for the right to run those schemes, and some actually get paid by the government because they're unprofitable. And if you just, as the franchises come up for renewal, if you just brought them back into the public sector, the cost would be the how much less you're getting, you're being paid for the right to do it. The real question here is there any reason to believe that either the state or private companies are better at running the railways, and how much money you put in? Because we already put a lot of public money into the railways, and actually, if you look over the last 20 years, usage of the railways has grown enormously since they came into the private sector. But that's not necessarily because they're in the private sector. That's because demand in various ways has grown as well. So the issue is how are they best going to be run?
Is there any evidence elsewhere about who is better at running these kinds of services?
It often depends on the market structure. Is there some competition there? It really depends on how much money is going in, probably more than the ownership. But those of us who are old enough can remember the railways before privatisation, and they weren't great.
Okay, we have a question about minimum wage. So the Conservatives brought in a national living wage, which isn't the same thing as the living wage, which is a voluntary thing that companies can sign up for, right?
Right, that's yes. So you've put the confusion perfectly. So various organisations have been campaigning for a long time for what they call a living wage, which is supposed to be an amount which is enough to live on. Mm-hmm. Though, of course, the amount you need to live on depends a lot depending on your housing costs, or whether you've got children to look after, or whether you're living at home with your parents or what have you. I need a lot more to live on now that I've got 4 children than I did before I had 4 children. But the national living wage that the Conservatives brought in is actually just an increase in the minimum wage. So okay. The minimum wage we've had a minimum wage in the UK since 1999. Mm-hmm. It has traditionally been set.
Did you really not have one before 1999?
During the 1990s, we didn't have one at all. In the period from 1909 until 1993, we had things called various different things, but wages councils right. At the end, which set minima in particular industries like agriculture and garment industry and so on at different rates. There was one for fancy ostrich feather makers or something, I think, in the 1930s. But it wasn't a national minimum wage, and that was, and it didn't cover everyone, and that was got rid of in 1994, I think it was.
Okay.
Minimum wage came in 1999. Until 2014 or so, covered about one worker in 20. Mostly part-time workers and overwhelmingly women. But only about one worker in 20. Now and it was set by this thing called the Low Pay Commission, whose job was to say, what minimum wage can we pay, which we're pretty confident isn't going to result in fewer people having jobs, because of course if you force companies to pay more and more and more, then they may end up reducing the number of people they employ. Now, George Osborne decided that was too conservative with a small c, and decided he wanted actually to try out a higher level of the minimum wage, which is called the national living wage, which goes to people over the age of 25, and that's heading towards £9 an hour by 2020. And by then we expect it to be affecting not one worker in 20, but more like one worker in 8. So it's a really, really big change from one worker in 20 to one worker in 8 over the age of 25. Now the Labour Party are outbidding. So they say not £9 an hour, let's have £10 an hour, and not £10 an hour just for the over 25s, but £10 an hour for everyone over the age of 18. And that's radically different. Right. So that means that nearly 2/3 of people under the age of 25 would actually have their pay set from Whitehall at £10 an hour. So every 18-year-old would have to earn £10 an hour. That's £20,000 a year full-time. That's quite risky, actually, setting the wages of a majority of 18 to 24-year-olds at that kind of level.
So we've got a question in from Tom that says, why have wages not risen in line with inflation?
Well, that's a very good question.
Is it true?
Since 2008, it is true, actually. Okay. So wages fell up till about 2013 relative to inflation quite a lot. They were picking up over the 2014, 2015, 2016 period. But the bad news is that since the Brexit referendum, the value of the pound has gone down. That makes imports into the UK more expensive, so inflation has gone up, and wages haven't risen in line any further. So wages have stopped rising again. They were beginning to rise, but they've stopped again. So average wages now, sadly, are still below where they were in 2008. And the underlying reason for that is productivity hasn't grown. In other words, the amount that we produce with every hour we work doesn't appear to be rising. And why that is, well, that's a very big, long question that I'm not going to try and answer right now.
So we've got 5 minutes left, so we're going to try and zoom through some of our questions. Are any of the parties going to help with falling wages and living standards? We've kind of already touched on that a little bit, but can you tell us a bit more about the parties now?
What do we add to that? I mean, I guess maybe one thing worth saying is that the Conservatives didn't have very many policies in their manifestos, but there's already actually quite a large cut to benefits due to be coming in. Now, the Labour Party would reverse some of those, but not most of them. So under both the Conservative and the Labour Party, there are cuts to some of the benefits for working age families with children that are due to come in, and that will obviously affect the living standards of some of those families.
I think what's quite depressing about both the manifestos of the big parties is that I've described the difficult economic situation we're in and the risk that we face going forward. You wouldn't know that was a problem if you looked at their manifestos. They're not really trying to address the underlying economic issues.
So, at Full Fact, we've been asked quite a lot whether the manifestos have been costed well, if a certain party has thought about that more than any other. Do you guys have anything you could add to that at all?
Well, the Conservatives haven't really said much in their manifesto. So, in a sense, there wasn't much to cost. I mean, genuinely, there wasn't much to cost in there. I think what I could make out their strategy has been to say, we'll carry on essentially as we are, but we're going to leave ourselves the freedom to raise taxes, which I suspect they would. And we're really not going to tell you very much about what we're going to do on the spending side. Labour Party has got some very, very big spending commitments and some very, very big tax commitments. The spending commitments, from what one can tell, look like they're properly costed. They come to £75 billion a year. And just to be clear, £75 billion a year is a very, very, very big number. That's like 10% increase in in the amount that we spend. But as Helen said, that doesn't include extra money for undoing the welfare cuts. It doesn't include actually very much for the NHS, so maybe they want to spend more than that. On the tax side, they've provided a set of numbers which add up to £50 billion. The trouble is they don't really. You couldn't get £50 billion from the tax rises that they've suggested. What they're talking about is getting the UK state closer to actually the average size of spending in the rest of Europe, which is absolutely economically sensible and reasonable thing to do. But if you're going to do that, you need to raise taxes properly. And by properly, I mean need to raise taxes on most people, whether that be through income tax or VAT or national insurance contributions. You cannot do it in the way that they're describing, which is entirely by raising corporate taxes and taxes on the rich. That's just not doable.
Okay, so 2 quick questions to end off. There's been some recent criticism of the IFS as being an institution that doesn't do macroeconomics. Could you first of all tell us what macroeconomics are? And what are the implications of this criticism, and how should we read IFS's findings about the election manifestos in the general election, given the extensive coverage that the IFS has got about this?
Well, I take macroeconomics to be, I think in most people's minds, forecasts about what's going to happen to unemployment and the size of the economy and so on going forward. And we don't tend to make forecasts of that, partly because it's a bit of a mug's game, it's very difficult to do. And as I said right at the beginning, everything we do is based on very careful analysis of actual data. Now, does that matter for what we're saying? Well, we thought a year ago in the run-up to the Brexit referendum it did, because you could say with almost complete certainty that the UK out of the single market would be worse off than the UK in the single market. I mean, there really isn't much doubt about that. If you're looking at the 2 parties' manifestos now, though, there's a lot of doubt. The Conservatives want to do some things which would make us worse off, I'm afraid, cutting immigration being one of them, continuing to austerity is like to be another. The Labour Party wants to do some things which might actually grow the economy, so a big increase in investment spending, for example, but they also want to do things which would have the opposite effect. Big increases in corporate tax, big increases in labour regulation, which, in 5 years' time, which would give us the bigger economy? I don't know, and anyone who tells you they know is either, I would disagree with them that they knew. Let's put it that way.
And finally, are there any questions that you don't see anybody asking, but you would like people to be asking more?
Blimey. I think it partly comes to the question you asked earlier about, what are the parties saying about the economy and what they would do to make things better? And I can't remember an election where we've had less discussion about the economy, where we've had less discussion about the impact of a higher or lower amount of borrowing. We've had less discussion about the impact of minimum wages and so on. We've got 2 manifestos out there which are really radically different and will have radically different impacts. And yet, actually, we haven't, I think, been told by either the parties or the people questioning them quite how different they are and quite what those impacts are likely to be.
Okay, well, thank you so much for answering our questions. And if we haven't answered your question, then we will be replying in the comments with links to fact checks or briefings or explainers. Hopefully we'll get through as many of them as we can. Join us in about 5 minutes for another Q&A, but this time on health. And I'll be joined by 2 experts from the Nuffield Trust. Thanks very much. Hello and welcome to the Health Q&A brought to you by Press Association and Full Fact. Full Fact is the UK's independent fact-checking charity. We've been busy fact-checking the election. You can see all of that work at fullfact.org. Today, we have the country's leading experts to answer your questions on health. So be sure to click comment below. Send us your burning questions on health, the NHS, whether it's in crisis, everything, and we'll try and get through it in the next 30 minutes. And then also click share so your friends and family get a chance to ask their questions too. I'm Mivan from Full Fact, and I am joined by John Appleby and Mark Diane from the Nuffield Trust. Hello.
Hi. Hello.
Can you tell us a little bit about yourselves and how you're different from the other Nuffields that exist? Because there's Nuffield Trust, Nuffield Health, and Nuffield Foundation.
Yep. I'm Mark. I work in the sort of policy analysis bit of the Nuffield Trust, looking in particular at issues like devolution, Brexit and legislation.
Mm-hmm.
The Nuffield Trust is a sort of research charity, some people call us a think tank, set up basically to examine hospitals and healthcare in the UK and make recommendations to improve them, basically. And we do some sort of political work as part of that. We were originally given our money by Lord Nuffield, who was a very, very rich man sort of around World War II.
One of those.
Who also went around setting up an awful lot of other things. So there's a Nuffield College, there's Nuffield Health, which runs private hospitals. There's another Nuffield Trust for the armed forces. And although it's a bit confusing, we're completely separate from all of those, apart from that we had the same founder 60 years or so ago.
I think the really important thing is that we're independent. We're not politically aligned.
Okay.
We have our own endowed fund, so we can say what we like. And so, I mean, I think those are the key things in terms of our organisation. And by the way, I'm the chief economist at the Nuffield.
Great. And if you'd like some more information about that, we'll be sure to put it in the comments. So, the Naylor report. There's been a lot of claims flying around about what it means for the NHS, whether it means the NHS has to sell off its land. Could you tell us a little bit about it?
Well, as it happens, here it is. This is the Naylor report.
That's so cool.
It's published. Robert Naylor, Sir Robert Naylor, was a past chief exec of University College Hospital, a lifelong NHS manager, as was, I think, both of his uncles. He's retired now, but was asked to look into how best should the NHS get the best value out of its estate, out of its land, out of its buildings and so on. The NHS owns a lot of buildings and land. Over the years it's been selling off chunks as and when. For example, in the 70s, 80s and into the 90s, healthcare changed. We didn't need so many long stay hospitals, and a lot of those were sold off and developed, and the NHS got the money and so on. And what Robert Naylor is really saying here is this is a big resource. I can't remember the exact figure, but we're talking about maybe £10 billion in terms of land value.
Yeah, so what he's basically saying is the NHS needs £10 billion in order to fund these plans it has, mostly to provide more care outside hospitals. And in order to get that, he's suggesting that they sell off potentially up to about £6 billion worth of the land they've already got.
Right.
So the important thing to realise is it's almost like a swap. The idea is the NHS will sell off some of the land and buildings it's got at the moment in order that it can buy new land and buildings and computers and so on.
So if it sells off that land, what happens to those hospitals?
So in many cases, those might be bits of hospitals or land that aren't actually used. In other cases, I would imagine they'll move the stuff that was there into new places.
I mean, the idea is to make, it's a resource, it's a big resource, and the thing is, is the NHS using it efficiently? The NHS is paid for by taxpayers. I'm a taxpayer. I'd like to see my tax pounds used as efficiently as possible in terms of the NHS. It's not a case of decanting patients from hospitals and flogging off the buildings to big property developers and so on. That's not the intention. The intention is to make good use of this resource. And I have seen some comments, people saying it's like selling off the family silver and so on, but it's a sort of family silver that's never used, in a sense. So it makes sense it may be in terms of selling off land, it may be that the NHS ends up with partnerships with people to develop the land and develop buildings and so on. So there could be a variety of ways of using it. I mean, one of the things that Robert Naylor recommends is we have a real problem in places like London with vital health workers not being able to afford to live near their place of work, for example. So one option is to develop land to provide that sort of accommodation.
But I guess here's the question that I've seen a lot in a lot of comments on the internet is, how comes the NHS needs to raise this kind of money when a lot of people, well, the government is claiming that it's given it the most money that it's ever been given?
It's not so much a case. Well, there are two separate questions there. One's about how much money the NHS has given, and the other is really about, in terms of the resources it's got, land and buildings in this case, how to make best use of that. Yes, of course, the health service could do with lots more money, and then not sell off the land. But that's just using resources inefficiently, and it's a waste. So there's the land and buildings issue. On the money side, yes, the NHS has got more money in real terms, but only marginally. So it is under pressure financially.
I guess also some of the stuff that gets tied into the Naylor report is privatisation. Could you explain a bit about?
I don't think it's necessarily got that much to do with it, really. One is about selling land,
Sure.
but retaining the services with whoever they're being provided by at the moment. What people tend to mean by privatisation in the NHS is when the NHS contracts with private companies to deliver care, where that care might once have been provided by an NHS trust. Obviously, there's another whole area of privatisation which has always been there, which is GPs, dentists, pharmacists, optometrists, and so on. They're also private companies. I wouldn't see that as very connected to the Naylor review, but it is actually true that the amount of NHS care, or the proportion provided by private companies in that way, has been going up for about 10 years under successive governments. It's still a fairly small proportion of the total amount the NHS spends on delivering care.
Sure.
Most of it's still done by NHS trusts, which are, publicly owned, the public sector bodies. But it has been increasing somewhat.
Okay, and we've had a question that says, are so many trusts in so much debt as a result of previous public-private partnership policies?
I think the short answer is no.
Okay.
I think they're referring to the private finance initiative,
Okay.
which was an idea which goes way back to the 1990s, actually. The Conservative Party at the time were looking to see, is there a way we can build more hospitals? A lot of the NHS housing, hospital stock in this country, some of it is Victorian. My first job was in the health service in Birmingham, and I worked in what was an ex-workhouse. The walls were 3 foot thick and so on. It wasn't designed as a hospital. So there was an urgent need to upgrade all the buildings and so on. How do you do it? Where do you get the money from? You can get it from taxpayers, you could borrow it. But a third idea was mooted, which is get the private sector to stump up the money and have a sort of partnership in terms of the design and build and the delivery of some of the essential estate services. So that was the PFI idea. And in the end, it was really the Labour government who got it going under Gordon Brown and so on. And so hospitals, bought into a mortgage, essentially, as many people have. So that we bought hospitals on tick, and we got a lot of brand new hospitals, but we ended up with an ongoing debt going into the future. I think, I mean, how much a year is the NHS paying on
the
that?
The NHS pays about £2 billion a year. So I think it's worth saying that, for many trusts, they don't have much in the way of PFI obligations. There are a minority who do have fairly hefty amounts to pay back, sometimes because of what's happened to the interest rates at which they're paying it back compared to the rest of the economy.
As a proportion,
in the context of the overall NHS budget, I mean, it's about £1.60 goes on.
It's a very small
PFI.
fraction of the budget. And in fact, individual hospitals, it's by no means the biggest costs. I seem to remember Barts in London, who have one of the biggest PFI schemes. It might be looking at 13-14% of their turnover, and that would be the tops. I mean, the biggest chunk of spending within hospitals is on pay, by the way. It's 75% of costs. So it's more to do, if you're looking at reasons why a hospital may get into trouble financially, it may be to do with employing more staff and pay rises and so on.
So we have had a question in that basic kind of ties in a lot of this stuff, and it's maybe too big to answer, so feel free to break it down. But is the NHS sustainable at where it currently is? Like, what are its biggest problems right now?
Any more sub-questions there?
No, I thought I'd just
one.
cap it there, just the big one.
Shall I have a quick kick-off at the sustainability one? I think most people, what they mean by that is it somehow financially sustainable given the pressures on it? I guess that's the underlying what the question's about. Well, interestingly enough, there was a House of Lords Committee report on this only a few months ago, We gave evidence to that. I wrote a briefing for them, looking at the sort of funding pressures into the future, because you need some numbers really on this. So what are we spending now as a proportion of GDP, our national wealth? Not that much on the health service. It's around 7% of GDP on the NHS.
And is that more or less than other countries that have health services?
It's hard to compare with other countries because they fund it in different ways, and so you have to add in private spending as well. We're about average across the EU 15 countries, right? So that's where we are on OECD numbers.
Sure.
But 7% of GDP isn't actually that much. That's actually less than the Americans spend publicly on their health service. So through Medicaid and Medicare and tax breaks, they're spending over 10% of GDP through public money.
Yeah.
And overall about 18%, so nearly $1 in 5. Anyway, back to in terms of the UK.
Back to here.
Yeah, back to here, sorry. Our starting point is actually quite low, and we could increase our spending at a sort of historic long-run rate of 4% real increase a year, and we could easily afford it if it was sort of gradual over the years. So, in my view, looking ahead to, and the evidence I gave to the House of Lords Committee, 2030, yes, we would spend more, but our economy would be bigger, we would be richer, and one of the things we like to spend our money on, our extra money on when we're richer, is healthcare. So I think we'd be happy to spend that money, basically.
I think there's also another sub-question that tends to be in people's minds when they ask if the NHS is sustainable, which is about, given the NHS is obviously under a lot of financial pressure, is the answer to sort of ditch that taxpayer-funded model and move to a different model where you pay privately or through social insurance? And I think the thing to say there is that's not quite an answer to that question. You know, if you're deciding that the health service needs more money than it's got now, then whether or not that's taxes or it's social insurance out of your paycheck or private insurance out of your paycheck, you're still paying more. It's just badged a bit differently.
Okay, if you have questions for John or Mark, then please send them to us. We'll try to get through as many of them as we can. We're going to just scoot ahead a little bit, and a lot of people have asked us about the 5-year forward view. What is that?
I believe you got that one as well.
I've got another printout.
Strangely enough, I also have that one. Well, the 5-year forward view is essentially a 5-year plan. It sounds rather Soviet, but it's a 5-year plan for the NHS, published in 2014, so getting on for 3 years ago now. I guess we're into year 2 or 2.5 of the 5-year plan. We're getting it halfway through. I think what really underlies it is it's the NHS's response to the funding pressure that it's under. So the NHS is getting more money each year in real terms, but it's nowhere near the increase that it would need to keep up with population, the elderly, technological progress, medical advances, all the things which push the pressures on to spend more. And this is really the NHS's response. So how do we, in a sense, close that gap between the money we've been given and we know the demand's going up? How do we fill that with more productivity, better care? I mean, in fact, and the Robert Naylor's report is sort of tied into that. How do we make better use of resources? So that's the sort of underlying driver for this, and it contains ideas for improving services, integrating health and social care, working with the health service, working with local authorities. There's a big experiment going on in Manchester where local authorities and health are really getting together to think, well, how best to provide not just healthcare but social care as well.
So does it make policy recommendations?
Yes. Well, it's a sort of focal point. I mean, what's then flowed from this are STPs, which I now momentarily forget what that stands for.
Sustainability and Transformation Plan, I believe.
Fun.
Thank you, Mark. Right.
I think it's worth saying that running through this as with the Naylor Review is a narrative that's quite popular in the NHS as a way to sort of respond to the problem that it kind of needs to do more with not very much more money, which is this idea that people will be treated with less of a reliance on hospital care and more outside hospital in a GP surgery or in their houses. And that, that's already happened for several years to some extent, in particular because hospitals are treating people more quickly than they used to. But that's the sort of hope is that by treating people in those sort of less intensive places, you can contribute to doing more with the same amount. And I think a lot of what's in there, which is a lot of quite complicated organisational changes, has that as the sort of driving principle.
So is adult social care a part of this?
Yes, it is really.
Could you first of all explain what adult social care is for the people who don't know?
Well, yes, social care is really care and support for often elderly, frail people in their homes. It may be a combination of adaptations to their home. It's a Meals on Wheels, I think, is how people tend to think of this sort of thing. It's really support for people in their what is known as activities of daily living. So my dad's 90. He needs a whole panoply of support to help him get meals and so on, so he survives in his home. So this, yes, it is about getting health and social care together, which traditionally have been funded in different ways and provided by different people.
Okay.
But I think one of the crucial things about the 5-year forward, well, two crucial things about the 5-year forward review. One is it really did emphasise that a basis for making these changes was having the money to do so. And there is a tension now between the NHS and government, with the NHS, I think, feeling the government haven't honoured its side of the bargain here.
So what was the bargain?
Well, the bargain is that the NHS should get more money than it's getting.
What is it getting? And what
Well,
was
it's
it
getting
promised?
a shade over 1% real increase a year at the moment.
So the promise a lot of people will have heard and seen arguments about is the 8 billion extra funding for the NHS, which is one interpretation of what the 5-year forward view is asking for to deliver what it sets out.
Which 8 billion is a lot of money.
It's a very large amount of money, but that is only a 1 or 2% increase a year, given how massive the NHS budget already is.
Which is what? 100.
It's about 124 billion in England alone.
Great.
And so the government did pledge to give that extra 8 billion to NHS England, but they did so, and full facts done a very good fact check on this, partly by taking money out of some other health budgets like medical training and public health. So there's some tension, as John says, as to whether or not that funding side of the bargain has been filled.
Okay. And
So anyway, this plan is
Yes.
it's as I say, it's the NHS's response to what the political decision to give the NHS the money it gave it. So the NHS couldn't really do anything else. It has to try and provide the services. People keep turning up at the front door of A&E. They need treating. They can't be turned away. We've been in a period over the last 18 months where a lot of the headline targets in the NHS have got worse. Hardly any hospitals are meeting the A&E 4-hour wait target. The elective wait targets are being missed as well by many people. There's cancer targets being missed.
and is that because of funding? Is it a plethora of reasons? Is there any one thing that it can be tied to?
It is a combination of reasons, and it will vary from hospital to hospital.
Right,
So
okay.
that is always the case in the NHS. But funding underlies the problem. I mean, there's a degree of, are we organising the flow of patients properly through the system and so on.
Okay.
But I have to say, one of the big problems is that basically beds are full.
Okay.
And if beds are getting full, you can't get people through the A&E department, and so they pile up there and waiting lists grow and so on. So also with social care, so the whole system is interconnected, and you get bottlenecks and problems. But money is an underlying problem.
And how have the manifestos of the parties, have you guys looked at that regarding the NHS? Could you distill what the manifestos say?
So, John, do you want to talk about funding, and I'll take the other bits and pieces that are in there?
Yeah, sure. So we've looked at the three main parties: Conservatives, Labour, Lib Dems. They've all made various promises and pledges about how much they would put into the NHS if they got into power. It's hard to interpret exactly how much each party
They all
put
counted in different ways.
Right, okay.
This always happens
Frustrating.
in manifestos. It's never quite clear enough, unfortunately. But our interpretation, the headline figure is that Labour promised to spend more than the other two parties,
Okay.
and Liberal Democrats are some way between the Conservatives and Labour, but they're very close.
Okay.
And the other thing to say is the pledges don't even match the growth rate of the economy. So over the next few years, the economy is expected to grow in real terms,
Right.
and at about 2% a year, let's say. The pledges from the parties don't even match that growing pie. So in fact, what they're pledging is a shrinking share of that growing pie, slightly.
Okay.
And I don't think, to be honest, I don't think they've grasped the enormity of the numbers, actually. I mean, we talk about £124 billion for the NHS in England. It's about getting on for 160 billion across the UK.
Yep.
It's over £300 million a day the NHS spends. And so 8 billion, of course, is big, but in comparison to the bigger numbers, it's relatively small.
Yeah, absolutely. So we have a few questions on staffing, and there's just a question that says, do the staff get paid enough in the NHS? Which is lots of different stuff, I appreciate. But
whether or not someone's being paid enough is a matter of opinion. I think most people would agree that nurses probably deserve as much pay as we can give them. Okay. But with the NHS in the financial strains it's been under, it's certainly true the real pay of many NHS staff groups has gone down. And I think you'll have views on this, but there are signs that is starting to get to the point where it's quite difficult to recruit for some key professions.
Yeah. Nurses, one of them?
Nursing is certainly one of the professions that has the highest problem with a vacancy rate, so posts that aren't actually filled. And I think it's probably one factor, although there are many others, in that is perhaps that pay rates have been held steady as the NHS strives to make these efficiencies.
I mean, there's been a public sector pay freeze, essentially, or a cap on public sector pay rises. So I think consultants now have essentially had their pay frozen for, must be getting on for 7 years now. GPs, 6 or 7 years.
Difficult with GPs because
I realise that, yes.
Yeah.
Nurses, porters, managers, and so on. So in real terms, their pay has gone down quite a lot.
Yeah.
Okay.
And so part of the way that the NHS has managed to close that funding gap is actually being borne by NHS staff directly through their pay packets. So I think we should recognise that. Are people getting paid enough? Well, the average wage for a consultant is something like 110,000 a year. It's not bad. The average wage for a nurse is above slightly the median wage nationally. Not bad, you could say. Mark's pointed out that there is a slight increase in vacancy rates, but still people want to work for the NHS and become nurses and so on. I mean, in a sense, that's one of the... Sorry?
Do they want to
yes,
still become... Are people still applying?
Well, people still apply to medical schools and, want to do nursing courses and so on.
So we don't have problems recruiting people for
There's
these
certainly
jobs?
strains at the edge, I think it's fair to say.
Okay.
But it's, the NHS still fills the vast majority of its posts, obviously.
I was just going to say that one of the choices that people may make in terms of a job, being a nurse, working in the health service, maybe what other jobs are there? And the thing is that the global financial crisis of 2008, 2009, the ensuing recession, and things still haven't really picked up. So in a sense, the NHS is operating in a labour market which is where the choices are perhaps more limited. If the economy does start to grow faster, the NHS could be in real trouble. I mean, just leaving aside Brexit and the issues that raises for employment in the NHS, because people's choices will be wider. Wages across the private sector will start to rise. Yeah. And we know when that's happened before that people who might have chosen to become nurses actually start to choose something else. So the competition for that labour starts to get stronger.
So how is it that there are certain people their wages aren't rising, and yet there are some headlines that claim that a locum doctor has got 500,000 in a year?
So locum and agency staff are not on the NHS pay scale. They're not paid in the standard way, and certainly they do often cost more per hour to employ than NHS staff, which is why controlling the amount spent on agency has been another part of the NHS savings drive with its ups and downs, I think.
Could you just explain what a locum doctor is? Really
sure, so that's somebody who, rather than being on a particular, having a permanent fixed post in hospital, or rather than being someone who owns a GP practice, they'll come in and they'll do maybe a few sessions a week, maybe they'll actually work most of the time there, but they're not on a sort of permanent contract.
Right.
I mean, the NHS is a big organisation. It needs some flexibility in terms of employing people on a temporary basis and so on, and it will pay a premium rate for that because they won't be paying various on national insurance and pensions and all that holiday and so on. So there is a premium for that. I think, the NHS has tried to squish down on these locum and agency costs, so because it's having to make best use of its money and so on. I mean, the ideal thing would be to employ enough people But again, you do often need that flexibility in terms of employment.
So we've had a question in, which I'm not
Yeah.
sure that you can answer,
Yeah.
but it's, where's the 350 million a week?
Well, as I think Full Fact quite rightly pointed out at the time, the truth is that we do not send the EU 350 million a week. We send it about 250 million a week, but then we get another 100 million or more of that back. And when I say back, it goes to British farmers, goes to British scientists, and it goes to deprived and rural areas like Cornwall and West Wales.
Yeah, but I guess this
So
question is getting at,
What we've
we were
freed up,
promised this
if
an
we
amount of
cancel,
money.
if you like, our annual EU membership fee,
Yeah.
what we free up is in the region of 100 million a week, which is 5, possibly 6 billion a year for the English NHS. Now, I mean, that's not bad. That would cover, say, the rate of economic growth for a couple of years, and that would certainly be very welcome. And in terms of when it will come along, it would be potentially from 2019 when we leave the EU. But there are a couple of caveats attached. One of them is it's looking fairly likely that we actually might continue to pay the EU a pretty large amount of money even after we've left. So partly that might be for the divorce settlement, to settle our outstanding debts and liabilities to the EU.
Yeah.
Partly that might just be that we continue paying into their structural funds so that we can have access to their markets. But that could bring that 100 million down a bit. And then on the other side of the ledger, if you like, you've got, if we leave the EU and it causes a major economic slowdown, which the Office for Budget Responsibility think it will, I mean, you know, nothing catastrophic, but just we won't be growing richer as quickly as we perhaps would have done for a few years at least, then that also has a knock-on effect on the public finances and on the money that's available for the NHS. And the OBR estimate that at potentially around 15 billion by 2020. So there is the chance that that extra money we'll get from cancelling our membership fees will be cancelled out for a few years at least by any slowdown in the economy caused by Brexit.
I think, frankly, it was an outrageous claim. I think we all have to admit that. It was a bit of political propaganda. So, as Mark says, it's nowhere near 350 million. It won't go all to the NHS. What happens to those Welsh hill farmers and their EU subsidies and so on? Is that going to be plugged by some of that money as well, which was all being plugged by EU money? It's not. I looked at my watch, and I mean, it's not going to be this year, next year. It could or never, essentially.
Yeah.
So I think it was a completely spurious claim about the opportunity cost, if you like, of our membership fee for the EU. And as Mark says, I mean, 5 billion. If it's 5 billion, it's a one-off. That's how much the NHS needs in 1 year. What happens the next year and the next year and the next year? You have to add and add and add.
But with all that said, and I do agree with John that the 350 million figure is basically outright wrong. I'm sure a lot of people in the NHS will remember the suggestion that increased funding might be attached when it does come time to cancel the membership fees to Brussels.
So finally, last question. Is there something that you think the public should be asking more about the NHS? Is there a question that you don't hear enough?
Don't hear enough.
You're just bombarded with questions recently.
Do we want to give it more money or do we want it to do less?
Okay.
Because at some point, you can argue whether or not we're quite there yet. You've sort of got to decide.
There is a question I wish people would stop asking, actually, which
I'll
is
take it.
about privatisation. I think it's, in a sense, it's a sort of cul-de-sac idea. I mean, the more important issues around funding, around workforce, where will we get our doctors and nurses and managers of the future and so on? Are we training them in the right way? Privatisation is a sort of non-issue, actually, and as Mark pointed out right at the beginning, great chunks of the NHS have always been, in a sense, private, GPs, dentists and so on, and the NHS contracts with these private businesses. The NHS isn't under threat from that point of view.
Okay.
The pressures on the NHS are to do with funding and to do with the way we organise and run services. Those are the real issues which people need to focus on.
Interesting. I guess people feel very deeply about the NHS and don't want...
Of course. It tops all public polls. I mean, it's
Constantly.
loved more than the Royal Family, more than the Armed Forces and so on.
Yeah.
But, I think a big part of the reason that people worry about privatisation is what they're really worried about are the more fundamental principles of the NHS, which are that it's free and it provides close to everything a health service can provide.
Yeah.
Yeah, I think people are there's not much the British public believe in more than that, I think.
Okay, I think it's a good place to end it. Thank you so much to John and Mark for joining me.
Thanks.
Thank you to all of you watching. If we haven't had time to answer your question, I'm really sorry. But we will try and answer as many as we can in the comments. I'd like to thank Helen and Paul, who were here earlier from the IFS. Thank Press Association for streaming and helping us getting this going, and thanking Facebook for hosting us in this beautiful venue and taking care of all the tech. Thank you for watching, and hopefully we'll see you at the next election. Bye.